You didn't eat dinner last night, and you wake up, you're craving breakfast. So what do you eat? Peanut butter jelly sandwich? But there's something better. Nutella. You can't live without it. But some people, they can't live with it either. I'm one of those people. We'll be exploring my capstone project today, which is about food allergies, specifically how they affect people and how they're treated. We'll also be exploring other main points to help support our questions, like what causes them. 1 in 11 Americans has a potentially life-threatening allergy. But what is a food allergy? Food allergy is when your body, specifically your body's immune system, creates chemicals to attack the food that you ate. These chemicals, immunoglobulin E, IgE for short, bond to the proteins of the food and then bond to the killers of the immune system, which basically kill all the bacteria that enters your body. This causes an allergic reaction. This is basically an allergic reaction action. So inside your stomach, the food is traveling, which is what it should do. And these basophils are traveling, looking for bacteria to gobble up. When these IgEs attach to a piece of food and attach to the basophil thinks it's an enemy and starts creating a lot of histamine. Histamine is kind of like a message to the rest of the body that there's an invasion, and it causes symptoms. So for example, in a healthy person without food allergies, histamine in your nose can cause a runny nose. When I was in Spain, I ate a pasta and I had an allergic reaction. I had a mild symptom of trouble breathing, but I did not vomit or have rashes. Those are all common mild allergic symptoms. What basically happened was first my lips were tingling, next my tongue felt itchy and then numb. My throat swelled up and it got hard to breathe, but then it stopped. For some unfortunate people, it does not. Severe symptoms are too much fluid, a sudden drop in blood pressure, and respiratory arrest. Too much fluid in the throat can cause serious trouble breathing, while too much fluid in the stool can cause diarrhea. And you may be thinking, wait, how can diarrhea be bad for you? Well, all the nutrients get flushed out of your body, and it causes your body to have some more serious symptoms. While a sudden drop in blood pressure makes your muscles have trouble working, including your diaphragm, which controls your lungs, and your heart. Respiratory arrest is when you stop breathing. If respiratory arrest is left untreated, it will lead to death. What causes food allergies? People who don't know anything about food allergies might think it's a bacteria or a virus. That's not true. People who know a little bit about allergies know that there's a genetic component. But other than that, what causes food allergies? There's the environmental factor. Too much air and water pollution damages our immune system. And you may be thinking, wait, if our immune system's causing these allergic reactions, shouldn't a damaged immune system make allergies go down? But it does not. Because the immune system spreads all around your body. It is never completely crippled. Only the memory cells, which decide what is a friend and what is a foe, get hurt and damaged and killed. When that happens, your body starts attacking more things for no reason. There's also the diet of a pregnant mother. For example, mothers who eat no almonds during pregnancy are more likely to have a child with almond allergies. On the other hand, though, excessive ingestion of common allergens during pregnancy also increases rates of food allergies. There's also the way we eat our food. For example, in poor countries, malaria is much higher, while, for example, in America, which is a rich country, there is very little malaria. This is because we know how to treat it. But in food allergies, it's the other way around. Because we eat our food differently. For example, peanuts, we roast them. They're usually not organic and not natural. And the grease is usually not organic and not natural. When this happens, the immune system gets damaged. And as I said before, a damaged immune system causes food allergies. For example, in countries like India, they get water straight from the river and peanuts straight from the bush in their backyard, and they make it 100% natural. There's also feeding children common food allergens earlier. This is very new and becoming exceedingly popular among various food allergy specialists. It is that in this study that came out of Britain, there's a group of children who were not introduced peanuts until the age of 5, and those who were introduced peanuts at the age of 1. There was an 80% difference in food allergies, and children who were introduced to peanuts earlier had lower rates of food allergies. There's also the hygiene hypothesis. This is not as recent as the other theory that I stated before, but it is equally as popular. When we kill all the bacteria in our skin, on our skin, and in our body, it causes our body to not be used to all the bacteria and causes the immune system to attack the foods that you eat. How are food allergies treated? Of course, there's no cure and there's no vaccine, but there are ones in development. Before, very recently, the only thing you could do was prevent, because it was easier to prevent, but now it's getting more difficult to prevent since many common allergens, like peanuts, are found everywhere. In 1987, Survival Technology invented the epinephrine autoinjector, more commonly known today as the EpiPen. This is used inside the thigh by taking off the safety pin and injecting it into the thigh. This is used once and is held there for 3 seconds. This is basically how an EpiPen works. So during an allergic reaction, there's always the same amount of blood in your body. But when the blood vessels expand and swell up, there's less blood can reach your organs, and there's a lower rate of heartbeat, which causes not enough blood to go to vital organs. Vasoconstriction is what an EpiPen does, because EpiPen has adrenaline in it, which closes up the blood vessels a lot and makes them very tight. And this also increases the rate of the heartbeat. When this happens, more blood reaches the muscles, including the heart, and people can recover from their anaphylactic, which means whole body allergic reaction. There's also a new treatment which is called allergen-specific oral immunotherapy. What this does is it gives a tiny dust amount of the allergen, and under medical supervision, it increases it until, for example, they can eat, in my case, 6 hazelnuts a day. After that point, they just keep continuing eating it for 3, 4, even 5 years until they're cured. And hopefully I won't swell up like this unfortunate man who ate too many hazelnuts. I'm just kidding. He just got photobombed by a pufferfish. Speaking of pufferfish, you may be wondering, do animals have food allergies? Well, they do, but it is not as high in amount since the hygiene hypothesis does not apply to them. Since they're the ones licking the floor, they don't need to be any dirtier. That's my presentation.